with severe deficits in fine and gross motor skills. His parents want him to start requesting things like food in the bathroom, but he has never spoken any words and barely makes any sounds. What intervention would be best to teach Blake command? Where do we start? We ask ourselves, what is the question asking? And it's very elementary, but trust me, it helps you focus on the question at hand. What we don't want to do is read the question and then immediately start analyzing the answer choices. Let's take a minute to think about the question. The question wants to know what intervention will be best to teach Blake command. Well, our question says his parents want him to request things like food in the bathroom. So basic commands, right? How will we teach Blake command? Now remember, the information given in the question is what you're using to answer the question. So what they give you is important. So what do we know? We know Blake has deficits in fine and gross motor skills, meaning small hand movements and then large limb movements are difficult for Blake, severely difficult, apparently. Also, he's never spoken any words and barely makes any sounds. We have to take this into account when designing intervention. So what can we possibly do to get Blake to start manding? A, have Blake request a bathroom by saying bath. Now, Blake doesn't speak, never spoke, barely makes any sounds. Seems like a giant leap to get him to start saying bath all of a sudden. Based on the history, getting him to say bath does not seem ideal. B, teach Blake sign language so he can communicate all his needs. Sign language, a couple things. Sign language is a lengthy, difficult process to learn. Much less man for what he wants, we'd have to teach Blake an entire language. Plus, he's got deficits in fine motor skills. So not only would it be difficult for him to engage in sign language, we would also need to go through the trouble of teaching him sign language if we know sign language ourselves. A lot wrong with B. Doesn't seem feasible given the resources and given the history. C, show Blake how to exchange a picture for access to the bathroom. Okay, low tech, easy to do, easy to teach, can be learned by anybody. So far, C is much more realistic given our resources and our history than A and B. What about D? Teach Blake how to type the word food. Again, typing is not just a singular skill, right? Typing involves a lot of different skills plus fine motor skills, right? We don't just start typing words. We need to learn how to type letters, where to put our hands, typing quicker, et cetera, et cetera. We'd have to build up to Blake even being able to type a word like food. Again, resources, history, not going to work. Given the information, our best answer to teach Blake command would be show Blake how to exchange a picture for access to the bathroom. Once your RBT takes a week of baseline data, you instruct them to begin an extinction procedure on the client saying the word bluey. 5 days after the extinction procedure starts, the client starts saying the word bluey at a much higher rate than before. Which of the following answer choices is most likely based on the information given? What is the question asking? Well, it's asking specifically about the answer choices. Let's predict it. Let's work on our prediction skills. Part of practicing for the exam should be trying to predict the answers, meaning cover up the answer choices, look at the question, make a prediction. So what is most likely based on our information? What do we know? We know we've taken baseline data and we've started an extinction procedure on the word bluey. After extinction procedure starts, 5 days after, the client starts saying the word bluey at a much higher rate than before. What does this sound like? Well, we've implemented extinction and the behavior increased. Well, that typically indicates an extinction burst, meaning extinction is effective. So that would be my prediction. Let's see. A, the client's behavior was reinforced by the RBT's behavior. Now, it's possible, but there's nothing really that indicates the client's done or the RBT has done anything to reinforce the client. All we know is extinction started, and it appears the client is in the midst of an extinction burst. Nothing indicates the client's behavior was reinforced. The client's behavior was punished by the RBT's behavior. Well, the client's behavior was certainly not punished, considering the behavior increase. B is out. C, the RBT is implementing extinction incorrectly. Now, would you say the RBT is doing things incorrectly? I wouldn't. If the client's behavior increases after extinction starts, that's exactly what we would expect to happen because of the extinction burst. So D, the RBT is implementing extinction correctly, seems like the most likely scenario based on the information. We don't know anything about the reinforcement schedule. We don't know what reinforcement might have been given. All we know is we're using extinction, and extinction appears to be working because the client appears to be going through an extinction burst. So based on the information given, we would believe the RBT is implementing extinction correctly. Of the following, which is not a critical component of punishment? Our rule, when you see a term, punishment, reinforcement, any term, especially when practicing, define it in your head. Try to list off everything you know about that term. Yes, it's going to slow you down. The goal of practice isn't to do as many questions as you can. It's to learn and to get all your questions right. If you start seeing a term like punishment and listing off everything you know, your fluency is going to increase. You're going to get better at the questions. So we know punishment, first and foremost, decreases behavior. Punishment has ethical concerns around it, right? We need to deliver punishment continuously. We need to deliver punishment at the same magnitude. These are things we know about punishment. The question is asking about something that is not a critical component of punishment. So we're looking for something that is not critical when using punishment. The punishment must occur after the response. Well, punishment is a consequence, therefore it must come after the response. A seems like a no-brainer. B, the punishment must be something the client finds aversive. Okay, careful here. Yes, an aversive can be used as a punishment, but what about taking away an aversive? Can we reinforce behavior by taking away an aversive? Sure, we can use negative reinforcement. We can allow escape. So just because the client finds the punishment or the stimuli aversive doesn't make it a punisher. Same reason, just because the client finds the stimuli rewarding or they like the stimuli doesn't make it a reinforcer. The only thing that makes something a punisher or a reinforcer is its effect on behavior. So B, okay, is way too strong, right? We can't definitively say the punishment must be an aversive. C, the punishment must be delivered on a continuous schedule. That is true. Every time the client engages in a behavior, we need to deliver punishment. There's no threatening. There is no schedule. It is continuous. And then D, the punishment must decrease future behavior. That is also true. If it doesn't decrease future behavior, it isn't punishment. So of the following, which is not a critical component, B, the punishment must be something the client finds aversive. Eating chocolate chip cookies reinforces Wilson's behavior of verbally answering math questions, but eating chocolate chip cookies does not reinforce Wilson's behavior of writing math questions. This is an example of blank as it relates to the reinforcer effectiveness. What is the question asking about? It's asking about the reinforcer effectiveness. So what do we know? Well, we know chocolate chip cookies reinforce Wilson's behavior of verbally answering math questions, but chocolate chip cookies have no effect on Wilson's behavior writing math questions. Now, why might that be? Is it because of A, phylogenetic properties? Is it because of genetics? Is it because of a long, drawn-out, extended period of historic growth, of genetic growth? No, right? This is an evolution, okay? It's chocolate chip cookies reinforcing one behavior, not another, okay? This is ontogenic learning history. B, response effort. Could it be a response effort thing? Well, sure. If verbally answering your math question is significantly easier than writing the math question, maybe chocolate chip cookies are strong enough for the verbal answers, but just not quite enough for writing. Maybe Wilson prefers Skittles, and Skittles would reinforce writing. As far as we know, the response effort of writing is too high compared to the chocolate chip cookie reinforcer. What about C, competing reinforcers? Well, we only have a single reinforcer we're looking at, so nothing's competing. And then deprivation. There's no deprivation going on. Wilson's simply being rewarded for answering math questions. However, given the amount of response, effort will indicate whether or not the chocolate chip cookies are reinforcing or if they're ineffective. So this is an example of response effort as it relates to reinforcer effectiveness. Which of the following interventions is part of a self-management strategy? Now, if you have my study guide, which you should, we have a section on self-management that lists all the different parts of self-management. Okay, self-management is all about this idea, this misnomer of self-control, right? And we have different strategies. We have self-monitoring, all these ways where we can basically use automatic strategies to change our own behavior. Okay, so self-management is very important in ABA. We want to eventually get to the point where our clients can manage themselves. So which of the following interventions is part of that self-management strategy? Well, how about non-contingent reinforcement? Well, no, because non-contingent reinforcement is going to require another party continuously giving reinforcement on a schedule, right? So some sort of non-contingent schedule. This is not self-management. Restitutional overcorrection. Restitutional overcorrection is a punishment procedure administered by, again, a third party or an additional person, not self-management. Training loosely is a generalization strategy, okay, not necessarily part of a self-management strategy. Now, you could say, well, what if we use these different ideas in self-management? Maybe if you found a way to incorporate these in self-management, but they're not part of the package laid out in our task list and in our literature, okay? And that's what we're looking for here. So the intervention that is part of our literature, that is part of the task list, is mass practice. Mass practice is an intervention associated with self-management strategies. Kay is a behavior analyst who just took on the responsibility of a foster child. Kay suspects the child has autism, so she wants to conduct an assessment. The child is still in the custody of the state for 2 more months. Can Kay conduct this assessment? All right, question wants to know about Kay's right to conduct this assessment. So it's clearly ethical question. What do we know? We know Kay is an analyst, so she's qualified, who took on the responsibility of a foster child. Kay suspects the child has autism, right? So she wants to do the assessment. However, Kay is responsible for this child. Already, you should be thinking, well, this sounds like a dual or a multiple relationship, right? If Kay is the foster mother, should she be administering services to her foster daughter? Definitely not. What about the child is still in custody of the state for 2 more months? So Kay, before she can give the assessment, would need to do what? Well, she would need consent from the guardian, which is the state. So can Kay conduct this assessment? A, no, Kay would need the consent of the state. There we go. That's what we just talked about. Do we pick A and move on? Absolutely not. We read all of our answer choices. Because B, no, it would constitute a dual relationship, is also true. There's a double whammy here, right? K would need consent and it would constitute a dual relationship. C, yes, K is able to conduct the assessment. No, I gave you 2 reasons why she can't. So the answer is going to be D, A, and B. K would need consent first, but either way, it would still constitute a dual relationship. This assessment consists of manipulating antecedents and consequences in order to determine the function of a learner's behavior. Simple definition question. Sometimes I throw those in there, just fluency checks, essentially, right? We should always be checking our fluency. It's the number one thing. It's the most important thing. It's the name of the game. Fluency, fluency, fluency. You can't beat this test if you're not fluent, I promise. Okay, so do fluency checks. So what assessment consists of manipulating, keyword. We're manipulating things in order to determine the function of the learner's behavior. What about an indirect observation? Definitely not, right? Indirect observations are the lowest form of assessment, you could say, right? We're not actually observing anything. Event recording and ABC recording are both direct observations, but still we're just recording things. We're not manipulating things. However, in a functional analysis, now we're starting to manipulate antecedents and consequences. It's the highest level of assessment because it's the best way to determine the function of a learner's behavior through manipulation, again, of antecedents and consequences. So what type of assessment manipulates antecedents and consequences to determine the function? D, functional analysis. Which of the following answer choices represents a reinforcement schedule that would require you to deliver reinforcement every 4th, 5th, or 6th time the client responds? Another reminder, you need to know basic reinforcement schedules. Everybody focuses so hard on compound reinforcement schedules, they forget the basics. The truth of the matter is you're going to be using basic schedules a lot more than you will be using compound schedules. So you need to know basic schedules. If we're delivering reinforcement every 4th, 5th, or 6th time, is this an interval-based, time-based schedule, or is it a response-based schedule? Well, it's clearly response, right? Every 4th, 5th, or 6th time the client responds, it's not even the interval schedule. Doesn't help us really because all of our answer choices are ratio schedules, response schedules. So now we ask ourselves, is it fixed or is it variable? Well, fixed says it's going to be the same amount of responses every time. Variable says it's going to be an average. Well, if we have fourth, fifth, or sixth, then it's clearly on some sort of average. So we can eliminate A and B. So now we just need to find the average. All we do is add up 4 plus 5 plus 6, 4 plus 5 plus 6, and divide by 3, and we get 5. So on average, 5 responses, we're delivering reinforcement. We're going with a variable ratio 5 reinforcement schedule. A subject is placed inside a room with a variety of toys and activities during a functional analysis. An RBT is sitting next to the subject. Anytime the subject throws an object, the RBT says, don't do that again, or we don't throw objects. What type of condition does this most likely represent? Do you need to know the conditions of a functional analysis? You absolutely do. Don't neglect that part. Control condition. Control condition is simply you put a client in a room full of awesome reinforcers and let them go to town, right? We want to see what their normal behavior looks like. Typical day for the client. Alone condition. We're testing for automatic reinforcement. Given that the RBT is in the room, they're not alone. Contingent escape. Well, contingent escape says anytime the subject engages in escape behavior, you allow them to. It's not what is occurring. What is occurring is the subject is throwing objects and the RBT is providing attention. The RBT, with your help as the analyst, right, or whoever's doing this functional analysis, is conducting a contingent attention condition. The RBT gives attention contingent on the subject throwing objects,